Welcome back, everybody. Today I'm doing something a little bit different. As you can see, I'm filming outside. I'm just in my garden here. It's a beautiful day, the sun is shining, and the reason I'm doing this is to, I guess, maybe point out to some people that if they're isolating, if they're inside, if they're, in lockdown, that I want to highlight the fact that vitamin D is incredibly important for neurotransmitters, including the ones that make us happy and help with depression and anxiety, but it's also really important for immunity, okay? And this is one of the purposes of the chats that I'm doing, is to, I guess, point out how illogical some of these things that we are hearing from our so-called leaders are telling us. Some of the stuff just does not make sense. And if you look at my last video, I guess it's about showing you some information that I have, and then you can use your own discretion. You can discern and see if there's validity in the information I'm telling you, or if you can choose not to believe that and you can choose to question that. But the idea is, for me, I want to just promote people. They have to ask questions. They have to kind of speak up. They have to look around. They have to look at the information we have available to be able to make logical decisions. It's one of the most important things we can be doing right now. One of the things that just doesn't make any sense to me is these big organizations having these rules about wearing masks.
How intelligent you are. You only have to look at the box where most of us buy the mask, and it says this product is an ear loop mask. This product is not a respirator and will not provide any protection against COVID-19 or other viruses or contaminants. If that's what the mask is saying, can you imagine all these people that are tying like underwear around their face and scarves?
So I'm just going to play you a little clip of one of the chief medical advisors in the USA, a guy called Fauci, and listen to his rationale about wearing masks.
Right now in the United States, people should not be walking around with masks. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face. I do it when I'm in the public for the reasons that A, I want to protect myself and protect others, and also because I want to make it be a symbol for people to see that that's the kind of thing you should be doing.
So essentially he's telling you that he is wearing his mask as a gesture of solidarity without any science behind it. And I find that really quite incredible, especially when we know that there is terrible science behind the wearing of masks. And I'll just refer to this again. I've mentioned this a few times before, about I think he's a neuroscientist called Blaylock. And I'll just show you this article up here, and feel free to try and get a screen capture or look at the URL to be able to look at it yourself. So this here has a lot of references inside, and it goes through in detail about the harm that wearing masks can do over a prolonged period of time. Some people are more visual, and again, this is about looking at stuff and working out the facts and trying not to baffle people and try and put things into a very, very simple format. But have a look at this clip from, I think it's in South America. This guy's a firefighter, and he demonstrates the effectiveness of masks, or the lack of effectiveness of masks.
It's the safety video going viral. An Argentinian firefighter with a deodorant can, simulating a sneeze or cough. It's feared coronavirus could travel in the air, like deodorant does in aerosols. This demonstration showing most face masks are useless at trapping or blocking moisture, unless they're the N95 grade.
So you can see that people are being advised to make their own masks, wear cloth masks. We're importing thousands of tons of these materials all around the world, and quite simply, they're useless. They're only effective if you have a cold or a flu and if you're projecting droplets, okay? Otherwise, they kind of don't really do too much good.
Well, with the scare of the coronavirus, many people have been running to the store to buy face masks similar to this one to protect themselves.
Medical masks like this one cannot protect against the new coronavirus when used alone. Masks are really not necessary and they may actually be unhelpful.
But don't get a false sense of security that that mask is protecting you exclusively from getting infected, because there are other ways that you can get infected.
WHO only recommends the use of masks in specific cases.
And if you're not sick, you shouldn't be wearing a medical mask, but if you are, then you should.
People who are sick wear a mask. We recommend that people who are around someone who's COVID positive wear a mask, but do not recommend that the general public wears masks as a protective mechanism.
If you do not have these symptoms, you do not have to wear masks because there is no evidence that they protect people who are not sick.
And as somebody else pointed out, you know, what is it? Is it like a mask has some kind of viral magnetic aura around it? So in other words, you're walking around, there's all these viruses that are potentially trying to kill you everywhere, and the mask kind of just collects them all. What about the rest of your clothes? What about your forehead when you scratch it, your head, your hair, taking off your hat, taking off your clothes when you go home? What are you going to do there? If we're making this assumption these particles are around and going to kill us, you know, we essentially have to go into these sterilization chambers, throw all our clothes away, sterilize all our skin, and you know, then start afresh every time we go outside. The logic just is not there, and the science isn't there as well to support it.
I think people see a mask and they see an illusion of protection, that if they put the mask on, it'll somehow block viruses from getting into their mouth or nose when they breathe. That's just not the case. Anyone who does not have a respiratory illness, meaning a cough or sneezing, should not be wearing any type of mask, whether it's a surgical mask or a respirator.
But that hasn't stopped the public from buying up masks. Storage shortage.
The masks should be for the healthcare workers. The public should not be buying masks.
So the other thing I want you to do is have a think about some of the previous pandemics or outbreaks that we had. Can anybody remember SARS? What about the H1N1? What about Ebola? What about Zika virus? What about foot and mouth disease or mad cow disease? All these things, HIV even. There's clips of Oprah saying, you know, back in the 80s about how the world was just going to be decimated by HIV based on, again, computer predictions and models. These things haven't happened. And there's actually a fair bit of evidence to say that normal serious viruses have a lifespan of about 2 years at the most, and they die out. So I don't really get this fear-mongering that's happening in the mainstream media.
A professor of medicine and of epidemiology and population health at Stanford University. I'm direction from settings where we have more complete information about that denominator suggests that the infection fatality rate is much, much lower. We do have some situations currently where we are approximating that number with some fair accuracy. One situation was actually a very early experience in the course of the pandemic. We have a cruise ship, Diamond Princess, where we had an outbreak of SARS-CoV-2. Many people got infected. This is a situation where you have a closed space. People cannot really go anywhere. They live in very close quarters together for the duration of the cruise. So we had an infection rate of close to 20%. 19% of the passengers and crew got infected. And among those who were infected, as of now, 1% has died. 1% is a figure that pertains to a population of mostly elderly people. The mean age of the passengers and crew was 58 years old, and the median, I believe, was close to 65. And these include the following. First of all, it's demographics. Italy has the most elderly population in Europe and one of the most elderly populations in the world. The average age of people who die in Italy is 81 years old. And also, most of these people have lots of other underlying diseases. Italy is a country that has a very strong history of smoking. It has very high rates, therefore, of chronic obstructive pulmonary disease. It has very high rates of coronary heart disease. And these are very strong risk factors for having a bad outcome. There's also other things that probably got wrong in Italy. Italy has a relatively low number of ICU beds per population. It has about a third of ICU beds per population compared to the US. and their system is running at full capacity practically every winter. But you realize that a system that is so close to saturation, to having its maximal capacity, if you add just a little bit more, it can very easily collapse. And it still remains to be decided how many of these infections are deaths with SARS-CoV-2 versus deaths by SARS-CoV-2. There's also other things but I'm worried that if we see in the news presentations of single cases as heralded being something that I have never seen before, this is so horrible, that's the worst case of severe respiratory distress syndrome that I have seen, we are falling into a trap of sensationalism. I mean, can you imagine what would have happened if 60 million deaths that happen every year in this planet, we had a meter counting them one by one and having stories written for each one of them? It would be horrible. I mean, we have gone into a complete panic state, measuring so far a sizable number of deaths, but nothing close to the total cumulative mortality that we see both in this country and around this world. I think that that panic component and that overemphasis of media attention is probably making things worse. We do want to sensitize people.
But how many people have actually died with COVID versus died from COVID? And that is the question that we should be asking. Why are death certificates being changed? Why is a mandate to just put down COVID-19 as the cause of death? Why are people that are dying from suicide or motor vehicle accidents being labeled on their death certificates as if they've died from COVID-19? That is literally what's happening. A friend of mine from Atlanta, Georgia, his neighbor's son committed suicide 2 weeks ago, cause of death, COVID-19.
Because when someone dies in this country right now, they're not talking about the high blood pressure, the diabetes, the stroke. They say, did they die from COVID? We've been to hundreds of autopsies. You don't talk about one thing. You talk about comorbidities. Their vessels were narrowed. Their lungs were a smoker. COVID was part of it. It is not the reason they died, folks. It is one of many reasons. So to be so simplistic to say that's a COVID death because they have COVID, you know how many people die with pneumonia or people that die from flu, with flu I should say, it's not from flu. Their lungs were compromised by COPD. They had a heart attack 2 years ago. They have a weakened body. We aren't pressured to test for flu, but ER doctors now, my friends that I talk to say, you know, it's interesting. When I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID to maybe increase the numbers and make it look a little bit worse than it is? I think so. So this is what I'm hearing from physicians I talk to in Wisconsin, New York, and everywhere.
The other thing which I'm, I guess, quite passionate about is pointing some of these things out that don't make sense. Some of you who might have your ears to the ground might be hearing about a thing called hydroxychloroquine, and this is the drug that Trump was promoting. And again, every single opportunity that is there to attack this drug seems to be used. Now, I remember hearing about this drug back in late January or February from one of the world's leading virologists, a guy called Didier Raoult. And he was saying that he was having a 95% effectiveness rate with this. Since then, there's been loads of controversy, but I want you to remember that this is a drug that has been used for decades and decades to treat malaria, and it's even been given prophylactically with malaria. And for people who have been exposed to malaria, some of these people are older people, they have heart conditions, they have all sorts of chronic conditions, yet they still get it. And there has been no massive reporting of adverse side effects with it, okay? Have a listen to what this doctor says about some of the studies that have been done to prove that this very cheap drug is ineffective.
Just to start with, why, what is happening? What is the FDA letter? What did it cover? Why is it getting away from hydroxychloroquine, and what are its excuses right now?
Well, those are all the key questions, Del. So this revocation of emergency use is once again, it's not based in science. They cited 8 studies as the basis for their revocation, and those 8 studies were weak. Most of them were beneficial, but they were small. They put all the emphasis on one study by Tang, T-A-N-G, and that was a study of only 150 subjects. It was a high dose delivery of hydroxychloroquine. It was 1,200 milligrams. Somebody is not paying attention to what the clinicians out there are showing, like Dr. Raul, who has over 3,000 patients treated with about 600 milligrams a day for 10 days and producing amazing results. But they're padding these. They used basically the worst studies. They cherry-picked the worst studies.
So you can see that the content of the studies and the way they were formed is outrageous. They were using massive doses to try and prove a point that this very, very cheap drug is a killer. And I think this is the key word that we have to remember. It's a cheap drug.
No clinical benefit. And what they mean is they're not seeing an advantage. Just as many people are dying or more. So tell me, you know, what is it? When they say lethal dose, what do they mean?
Well, the dose is being used in both Solidarity, the WHO trials, and the Recovery, the UK trials, 2 independent studies. They were both using levels that were about 4 times the maximum dose for any medical condition. There are no medical conditions at which these doses would be prescribed. In fact, when Landry was kind of confronted with these issues, he apparently was making some kind of careless mistake, believing and maybe even misinterpreting hydroxyquinolone for hydroxychloroquine. But he was actually following the World Health Organization trial standards. The World Health Organization set these levels. This is what I mean by designing a research clinical trial to fail. This study was designed to fail using extraordinarily high levels that can, you know, hydroxychloroquine is an amazing medication. It's safe. Millions of, as you've shown, millions of patients are using them and have for long periods of time. But at higher doses, the therapeutic window is narrow.
And so in some of these studies, there was actually references. I was shocked to see that some of these studies weren't even done this year. They were done before we even had a coronavirus pandemic. Can you tell me about that? What were those studies there to prove?
Well, because one of the reasons it's cherry picking, Del, they're cherry picking negative studies to support the conclusion that they want to create, and they want to thrust upon the public. They want to mislead us and deceive us, because this is the benefits that are coming from hydroxychloroquine in clinicians, which is the preferred treatment of choice by 55% of physicians that were polled by Sermo. Most physicians believe that hydroxychloroquine plus azithromycin plus zinc is one of the best ways to treat patients with COVID-19. It's important to treat them early, but most of these studies are being designed with the intention of failing. And that's what this whole, you know, pattern of behavior looks like. Once again, I've seen it with vitamin C, seen it with vitamin D, and they're doing it with hydroxychloroquine. Why? Because hydroxychloroquine is safe. It is effective. At the short duration that it's used, it's safe. And it's very effective.
They pointed to some older studies, right? Weren't they trying to say, well, there is some history that
and I think this is the key word that we have to remember. It's a cheap drug. You have this other drug being touted, remdesivir, which is only in trial stages. And one of the trials that they recently did in it wasn't good. Basically, it failed the clinical trial. There's a concept that I refer to a little bit called the concept of blockbuster drugs. A blockbuster drug is a drug that basically makes a company millions and millions, if not billions, okay? And there's criteria for a blockbuster drug, and here's some of the criteria. One of them is it has to be under patent. If it's not under patent, another company can come along and make it cheaper. If it's under patent, one company can make it, and they can basically, if they say it's effective, charge whatever they want for it, up to $200, $300, $400, $500 a dose. Now, if you compare that to a thing like hydroxychloroquine, I think some reports say that one tablet is something like 20, 30 cents, okay, depending on where you get it and how you buy it and who's producing it. Is there a financial incentive for I guess, the media to be reporting that a cheap drug is effective and actually highly effective? The answer to that is very, very simple. It's a big fat no. Here, I'll just chuck up on the screen another report. This was back, I think, in about February or March, of the effectiveness of intravenous vitamin C. Now, this report is in Chinese, but there's enough English in this for me to be able to ascertain that the report is valid. And a few people have translated this as well, and they've been able to work out that the information in it is accurate and it's been verified. So essentially, high-dose vitamin C for people in the acute stages of infection were having very, very significant and positive results. Again, vitamin C is off patent, it's incredibly easy to manufacture, and it seems that at every turn, the effectiveness of it is being absolutely hammered. People are just discrediting it. There's a lot being written about vitamin C. And even, I'll just play another little clip here of somebody who had terminal cancer, and this was reported in New Zealand.
But they would have to be told they would lose their dad in 4 to 8 weeks.
It was, I mean, I've heard people crying before, but this was absolute howling.
The description of his bone marrow when they took it out was it was just jelly, and 60% of the jelly was cancer cells. And they'd done everything they could, given all the treatments they could, and just said, this is it, we've done all we can do.
But everyone reckoned without a treatment, often dismissed as quackery. The news that infusions of high levels of vitamin C just might help him.
His blood tests are completely normal. You wouldn't know there's anything wrong with them. I mean, that's, unbelievable that occurred.
Now, Anton's pretty convinced that it was all down to the vitamin C. What's your take on that?
I couldn't be sure. He'd done at the same time.
He's not alone in seeing a dramatic effect. We think that vitamin C is potentially another tool in the toolbox.
You'll remember Constable Anton Kuraya's remarkable comeback from terminal leukemia after starting vitamin C treatment.
I think his story's a really interesting and compelling story. He's not alone in the world in seeing a dramatic effect.
After using vitamin C a few times, my PSA, which is my blood levels, had dropped down. That's a good sign. We don't want high PSA.
Thinking he was okay, he stopped taking the vitamin C.
And of course it started coming back.
As the PSA levels came back up, he decided to go back to the treatment.
It's really helped me get on with life and move around, and I do feel great. I really do when I've been on it, and my condition, it's pretty good, I guess. Right, let's go.
So, does vitamin C take the credit for Graham and Anton Kuraya's good health, or is it something else?
We don't know what to make of it. We'd like to know what to make.
So the point being, if we have something really cheap and effective, why are we not using this? And the other point would be that we seem to have this motive to push through something that hasn't been adequately tested, and that is much more expensive than a lot of routine treatments that we seem to have available.
It's very, very hard, and that actual decision of, okay, let's go and give this vaccine to the entire world, governments will have to be involved because there will be some risk and indemnification needed before that can be decided on.
So I think that we have to be quite careful, and we have to stand up and be heard when we have concerns about some of this information we're being given. There's quite a big possibility that we risk being experiments or victims of things that are being rushed out for reasons that maybe are not as serious as what we're hearing through the mainstream media. And I've mentioned this before, but you have to be aware that we have a very protective layer around our bodies. Okay, it's when you put your hand on a surface, you can see an oily print that's left, especially if it's on a screen or on your phone. Okay, that's a type of fat. It's called a lipid. and it's a protective layer to keep stuff from harming our bodies. It's very important. It is also made up of lots of different bacteria which balance themselves out on our skins. And this balance of bacteria helps fight nasty bacteria. So to kill all the bacteria on our skins is outrageous. Okay, there's a thing called the hygiene hypothesis, and this has been discussed for decades, about how some children are less prone to getting infections when they're exposed to dirtier environments. One of the common components in hand sanitizers is a thing called triclosan, and this is another clip that just explains things probably far better than I can explain them.
You see, when we look at hand sanitizer, any kind of topical lotion or anything like that, sometimes we forget that it's easy for the body to absorb those things through the skin. You see, it only takes a matter of seconds for those lotions and those poisons to pass through that transdermal layer and enter the bloodstream. We always think of things like when we eat food, then we're ingesting it, or if we're taking a pill, but we forget that it's so easy to just absorb something through your skin. And here we are putting something on our bodies that we have proof is extremely dangerous to us. So that triclosan has been proven to be no less effective than soap and water, and it's also been proven to be extremely dangerous. In fact, in 1978, the FDA pushed through to ban it, but it got stopped right at the end of that entire phase. So it kind of got left lingering in this gray area of something that we know is dangerous, but we just haven't had the political process to really push through and ban it, probably because it's so darn popular. So let's talk real quick about what triclosan can do in a negative way. So first and foremost, when you're wiping out bacteria in your body, or you're wiping out bacteria on your hands, you're not just wiping out bad bacteria, you're wiping out the good bacteria as well. And when your body absorbs that, then you're also wiping out bacteria within your intestinal tract. You're wiping out bacteria within your bloodstream, and you're wiping out both the good and the bad. It's not always what we want to do. Now, additionally, triclosan has been shown to affect our hormones. It can actually alter how our body processes certain hormones. It can affect our estrogen levels, it can affect our testosterone levels, but it can also affect other components of the endocrine system that can essentially slow down your metabolism. So you never would have thought in a million years that by putting a little bit of hand sanitizer on your hand might literally be slowing down your metabolism. In fact, according to the proceedings of the National Academy of Sciences, it was shown that triclosan can affect your skeletal muscle health and your heart muscle health. And it does this by interrupting the cellular communication. In fact, it was shown that just one dose of triclosan, one dose of hand sanitizer, can reduce the effectiveness of cardiac muscle by 25%, and it can affect the output of skeletal muscle by 18%. That means that it's literally affecting your heart's output, and it's literally making you weaker. So now, you know, in my videos I talk a lot about digestive health, and I touched on it a little bit at the beginning of this video, but triclosan also affects your gut biome. You see, your intestinal tract, your gut, your entire enteric nervous system within your intestinal tract is all balanced out by bacteria. Man, it's got good bacteria and it's got bad bacteria, but if you're killing off both, you're really resetting that gut biome. And the thing is, we've got this thing called the enteric nervous system, which is all the nerve endings in your gut that communicate with your brain. And if you disrupt those, it can affect your mood. It can make you depressed. It can make you anxious. There have been countless studies that are showing the link between gut health and brain health. So now we have to think about topical, gut, and brain. So the second that we put some of that triclosan in our hands and it gets into our intestinal tract, well, then it kills off the bacteria there, and it can actually affect our brain and affect our mood, specifically talking about motivation and anxiety. So you can be less motivated and more anxious, which is not what we want. Now, the other thing is we all have different bacteria strains within our bodies to begin with. You know, one person next to you may have a 50% difference in bacteria than what you have. And if we wipe that out, then our bodies have to rebuild that from scratch. Like literally, we have to rebuild all the bacteria that's in our gut, which means that that communication with the brain can actually be altered once you're building it back. You see, you could be building back different strains of bacteria than you had in the past.
So essentially, there's at least the question mark that this stuff can be doing harm. So again, why are we just blindly accepting this? Why are we putting our hands in front of these people who are attacking us with these bottles that can be harmful and dangerous? And another thing which I think bears a lot of consideration is, again, the one-sidedness to this story that we're hearing. So we're hearing about the hospitals being overflowing, and I have this in my last video. Go back and have a look at, you know, some of these news reports that were talking about the crematoriums not stopping burning bodies, and then people went and investigated this, and quite simply it wasn't true. Here's a couple of clips of things that are much more concerning, and these are from two nurses who were working in some different areas, and here's what they had to say. So here's a clip of one nurse who was whistleblowing about some of the stuff that was going on in one of the intensive cares that she worked in.
Like, Black lives don't matter here. And I mean, that's pretty sad that somebody who is white and lives hundreds of miles away from the city gives more about these people than the actual people in this city. These people aren't dying from COVID. Let me give you several examples here. An anesthesiologist intubated the patients, and for about 5 hours, like, we were waiting on a chest x-ray to confirm that the placement was wrong. And in the meantime, while we're waiting for that, and we've told the anesthesiologist that it was placed wrong, because like literally only one side of the chest is like inflating, he dies. Okay. A patient had a heart rate of 40. I was literally ran out of like the patient's room to get like the director of nursing who was standing out there, and I'm like, can you stop him? He's going to kill that patient. He's going to kill that patient if he defibrillates him with bradycardia and a heart rate of 40. And the director of nursing just shook his head, and I turned around and he killed the dude. It's like going in Twilight Zone. Like, everyone here is okay with this. Look, the only way I can kind of put this into context for everybody is, and this is going to be kind of an extreme example, this is like really the only thing I can come up with. It's like if we were in Nazi Germany and they were like taking the Jews to go put them in a gas chamber, I'm the one like there saying, hey, this is not good, this is bad, this is wrong, we should not be doing this. And then everyone tells me, hang in there, you're doing a great job, you can't save everybody. They're murdering these people.
This is another clip of a nurse who was working in some different hospitals in intensive cares, and she was so horrified by what was going on that she ended up taking a hidden camera inside to show people that what she was saying wasn't made up. It's fairly compelling.
A 37-year-old, which is my age, was not a DNR. He has a full code. His family in-depth discussed with the doctors that they want us to do everything they can to save him. And he came in talking. He was very terrified. He was just like, you know, totally alert, knew what was going on, and they convinced him to be on a vent. Now he's dead. But the doctor said when I got onto shift that if he codes that we are not to resuscitate or try to save him. And we flipped.
This is important. I did say so if we can put a DNR order, and they said no. That's up to the attending.
Okay, so we're going to code him.
That's what I said, and they said no, we're not. I said yes, we are. We're obligated to. So then
You got to say something though, like it's our license. Unfortunately, you guys got to put in an order. Just something.
That's what I said.
Yeah.
I said I'm obligated.
Yeah. What did she say?
So then she's like, the higher up said. I said, I don't care what they said.
What higher up? God? We don't have a God here making any decisions.
I said I don't care what they said.
So we're supposed to. He's not DNR, but we're treating it as DNR.
Basically.
Does his family know?
His family knows the situation. I think they called them and they told them. They were trying to do a school attending consent for DNR. All day he spent like in the 80s saturating. It was this one on the forehead didn't work. It was this one worked. And it came out. When I changed it, I was like, oh shoot, it's 90.
Yeah.
So they started playing around with the
Oh shoot, it's 90.
He's still on pressure.
We changed the pulse ox
You put him on AC,
from his head to his finger, and he's like, oh, it's 90. He's fine.
Well, Elmhurst does have a policy given, like a COVID policy, given the scarcity of dialysis and blood.
It can be a chem code, it can be whatever.
That it's not, there's not a it's a difference. Normally the standard is whatever the family says, like we just do. So if they would say code them for 5 years, like we just do that until they die. It's a little bit different now because of the new policy in place with Dr. in place, which is that you don't need full family, like you can just tell someone that it's medically futile and that we're not willing to just pour blood and resources into something that would be impossible to get back. But look, he's 37.
All I can think about is that at least he knows that we were fighting for him when he died. No.
Aaron, we hear that the victims of COVID-19 tend to be over the age of 65 and suffering from other life-threatening illnesses. What you are describing and talking about, this is a 37-year-old man, correct?
Yes.
And as a nurse, it seemed, look, I understand there are scenarios where, you know, you can't resuscitate or it really wouldn't make sense. Someone is.
So my question is, why is this not making front page headlines? If there is even a tiny hint of this being not accurate or being untrue, it needs to be investigated. And then we need to have the headlines that these nurses need to be put up on charges and put into jail for making this stuff up. There's something strange going on. Again, this is a recent report of a huge group of doctors which sent a letter to President Trump to express their concerns about the policies regarding this pandemic. It's not these isolated reports of a few people here questioning. There's actually doctors all around the world who have got grave concerns about what we're doing and what's going on. And there's numerous reports that I'm seeing now of doctors getting deregistered and fired for actually speaking up against the mainstream narrative. This, I think, is one of the most incredible things for me. We can't have a silence culture. We have to have a platform where if we have concerns, we need to have the opportunity to raise those concerns. It's time, I think, for as many people as possible to stand up. It's time for our voices to be heard. If we are finding that there's holes in a mainstream narrative, we have to hold our so-called leaders accountable. We have to scrutinize, we have to question what we're seeing if we have facts to back up that what we're seeing is not accurate.
Condition like immunosuppression due to cancer therapy or due to organ transplant, if you have morbid obesity, that will also trigger a immunospiking cytokine storm that can kill you. So, you know, C19 is a virus that attacks those people that, you know, have something they really have to worry about to begin with. And if we're going to protect anybody, we got to protect them, not the school kids. The school kids are being destroyed by this lockdown.
Let me ask you this, because here on the High Wire, we've been reporting really going back more than 3 months now. I have been reporting on scientists like yourself, I mean, and world-renowned scientists, whether it's from Oxford or John Ioannidis or you name it, that have been speaking out from the beginning or near the beginning against these draconian measures. Peter Gutcha, who is one of the founders of the Cochrane collaboration, saying not only are these not necessary, but they are going to cause more death and destruction than this virus could have ever dreamed. When for you, as a scientist, because I'm sure you see the world differently than most of us that are just running around with their hair on fire trying to get our, the next bills paid and get to our kids' baseball game. At what point in this COVID-19 pandemic did you finally just say, that's it, this is absolutely absurd, which is where you seem to be at now? What set you off?
Well, this is my business. I'm an expert in analyzing epidemics and outcomes of epidemics and the social and economic burden of epidemics. And that's why, please, everyone, tell your friends, neighbors, family members, go to joelhay.com and fill out our survey, because we want to track the burden of this false epidemic pandemic on society. And what we will find is that the C19 virus itself isn't much worse than a normal flu. It clearly isn't any worse than the Hong Kong flu of 60. We not shut anything down. And by the way, I was there. I'm old enough to have been there. That was a momentous year, 1968. And a lot of things were in the news. I'll tell you what wasn't in the news was the Hong Kong flu, which killed 3 times as many people as C19, even if you believe the data.
Right. Come on, everybody. It's time to stand up, and it's time to look around us, and it's time to see what's happening. It's time to ask questions. But again, I just want to reinforce that point that if we have projects getting outside and getting sunlight and exposing ourselves to different bugs and pathogens actually helps our immunity.